Picture this: you feel a painless lump somewhere around your mouth or jaw. It doesn't hurt, so maybe you ignore it, thinking it's nothing serious. But what if that small bump was something more? Something rare, like a type of cancer you've never even heard of: polymorphous low-grade adenocarcinoma, or PLGA, a rare tumor that can form in your salivary glands. While salivary gland cancers are uncommon, knowing the signs, risks, and treatment options can be crucial in catching and treating this condition early. Let's dive into what PLGA is and what you need to know about it. What is polymorphous low-grade adenocarcinoma? Polymorphous low-grade adenocarcinoma, or PLGA, is a rare type of cancer that usually forms in the minor salivary glands. Now, salivary glands might not be something you think about daily, but they play an important role by producing saliva to help you chew and digest food. When tumors form in these glands, especially in the oral cavity, they can lead to significant health concerns. In fact, studies show that 55% of PLGA cases occur in the hard palate, the roof of your mouth. PLGA is called low-grade because it tends to grow slowly, and its cells don't usually spread aggressively. But that doesn't mean it's harmless. These tumors can still metastasize, or spread, though at a lower rate than more aggressive cancers. If left untreated, they can invade surrounding tissues and make treatment more difficult. That's why early detection is key. How common is PLGA? Salivary gland cancers themselves are quite rare, occurring in just 3 out of every 100,000 people annually in industrialized countries. Of those cases, PLGA accounts for only about 1.2% of intraoral salivary gland tumors. So yes, it's rare, but it's also something that shouldn't be ignored if you have symptoms that might point to it. What causes PLGA? So what causes polymorphous low-grade adenocarcinoma? Unfortunately, researchers don't have a clear answer yet. There's no single cause that can be pinned down, but we do know about several risk factors that may increase the likelihood of developing PLGA or other types of salivary gland cancers. Here are some potential risk factors. Age. PLGA typically affects adults over the age of 55. Radiation exposure. If you've undergone radiation treatment for other conditions, especially in the head or neck region, this could increase your risk. Radioactive substances. Exposure to certain radioactive materials may also raise the risk of developing this type of cancer. Environmental toxins. People exposed to industrial chemicals, pesticides, or even sawdust in their workplace are more likely to develop salivary gland tumors, including PLGA. It's important to note that having one or more of these risk factors doesn't guarantee you'll develop PLGA. It simply means that you could be at a higher risk, making it even more essential to watch for symptoms and seek medical advice if anything seems off. Symptoms to look out for. The tricky part about PLGA is that it doesn't always come with a big warning sign. In fact, the symptoms can be so mild or even non-existent in the early stages that many people don't realize something's wrong until the tumor has grown. But there are some telltale signs that could indicate a problem. Painless lump. A swelling or lump in the face, neck, or mouth is one of the most common symptoms. Facial numbness. If you notice numbness in the face, it's a red flag that should be checked out. Muscle weakness. Progressive weakness or even paralysis in facial muscles could point to a tumor affecting the nerves. Pain or swelling. Some people experience pain or noticeable swelling in the jaw, face, or neck. Remember, these symptoms don't always mean you have PLGA. There are other, less serious conditions that could cause similar symptoms, which is why it's so important to see a healthcare provider for an accurate diagnosis. How is PLGA diagnosed? Diagnosing PLGA involves both clinical evaluations and a series of lab tests. When you visit a doctor with symptoms like a lump or facial weakness, they'll begin with a physical exam and take a detailed medical history. But because many of the symptoms of PLGA overlap with other conditions, more in-depth tests are needed to confirm the diagnosis. Here's what the diagnostic process typically involves. Biopsy. This is the most definitive test. A small sample of the tumor tissue is removed and examined under a microscope to look for cancerous cells. Immunohistochemistry. Sometimes, a biopsy alone isn't enough to give a clear diagnosis. That's where immunohistochemistry comes in. This test uses specific stains to highlight certain markers in the tumor cells, which helps doctors distinguish PLGA from other similar tumors. Imaging tests like CT scans, MRIs, or ultrasounds are often used to get a clearer picture of the tumor's size, location, and whether it has spread. Once the diagnosis is confirmed, the next step is figuring out the best treatment plan. Treatment options for PLGA. The good news about PLGA is that it's typically treatable, especially when caught early. The main treatment options for PLGA focus on removing the tumor and preventing it from coming back. Surgery. This is usually the first line of treatment for PLGA. In most cases, the tumor is surgically removed, and sometimes the underlying bone is taken out as well to ensure all cancer cells are gone. Radiation therapy. Radiation is often used as a follow-up to surgery, especially if it wasn't possible to remove the entire tumor. It's also a useful option if the tumor is in a location that makes complete surgical removal difficult. Radiation therapy helps kill any remaining cancer cells and lowers the risk of recurrence. One thing to note, while PLGA has a relatively low rate of metastasis, it does have the potential to return after treatment. That's why follow-up care is crucial to monitor for any signs of recurrence. What's the prognosis for PLGA? Overall, the prognosis for PLGA is quite good, especially compared to other types of cancer. According to studies, the 5-year survival rate for PLGA ranges from 75% to 100%, depending on factors like the stage of the tumor at diagnosis and its location. Early detection is key. The sooner the cancer is found and treated, the better the outcome. Regular check-ups and follow-up scans can help catch any signs of recurrence early, improving the chances of successful treatment. Conclusion: why awareness matters. Polymorphous low-grade adenocarcinoma may be rare, but that doesn't make it any less serious. By understanding the risk factors, recognizing the symptoms, and seeking timely treatment, individuals can improve their chances of a successful outcome. If you notice any unusual lumps or changes in your mouth, jaw, or neck, don't ignore them. Early diagnosis can make all the difference in treating this rare form of cancer. Being informed is your best defense, and taking action no matter how small a symptom may seem could be life-saving. So, stay aware, stay informed, and take control of your health.